the care of the older client. So same thing we have to do, care of the newborn, care of the young adult, care of the elderly person, care of the adult person. So in nursing science, we have to take care by different age group, different aging group, like care of the baby, like 1 to 12 years is the one group. Another age group we divided 13 to 18 years old. Another age group we divided like 14 to 60. And last age group, which is called older person, it is 60 up. So this PowerPoint, we are going to talk about the age group 60 plus, right? So it is very important basically for our profession. And here, as I told you, as our profession, it is our profession, nursing. So no matter the age, all patients have the same right. I said it is. I know it is important to take care of the patient according to the age group. Like older person, 60 plus, the chance of falling. So you have to give the priority. Same as the newborn, most common infection, because they're immunocompromised, it is infection control, temperature, most priority. But although we want to say it is our principle, it is our ethics, no matter the age, all patients have the same right for what? For safety, same right for safety, same right for confidentiality, same right for pain management, same right for control the pain or comfortness, same right for involvement in their care of the family members, right? I said no matter the age, every client has a right to get the measurement for safety measure or their confidentiality, means not share the patient information with anybody. It is their right, whatever that is. Pain management, it is their right. Comfortness, and also the family member get involvement in their service. I mean, involvement of the family members. It is their right, I said. So whatever this chapter are talking about the older client management, but here something is important I want to share with you. And NCLEX board asked the question, what is the most priority of age group 1 to 12 years? What are the most common error, or what are the two most important nursing concerns about the age group 1 to 12? This is medication error or complication from IV. So if your patient age is 1 to 12, we should be concerned medication error or management of complication of the IV, because this age group, if we do something, countdown of medication is so complicated pediatrics medication. If we dealing with the age group 13 to 18 years old, our main goal or main target, because 13 to 18 years old, main goal, development relationship with the opposite sex. In this group, we have to give a main focus when you're doing the care of the patient. Also, help them to coping with body change, because the patient or client changing from 13 to 18 years old, this is changing, right? And sometimes when they're changing adolescence, puberty, it is difficult for some of them to coping mechanism. So as a health worker, we should help them how to cope with body change, adjust with the puberty, adjust with adolescence, make a good relationship with the friends or opposite sex. It is very important. And also, they need to establish independence from primary caregiver, right? It's in this age group. I mean, we are coming older group, then we continue. Before to go, I'm talking about age group 13 to 18, especially we give the priority in case of female menarche, right? Means first start of period or menstruation. And also if the man, it would be important to acne, because they get easily disturbed if any scar formation in their face or body. Acne in case of man, in case of female, menarche is most important. Little bit important in this age group, in psychiatry, mental health, in this group is dangerous because suicidal tendency is really high in this age group, right? I'm talking about the 13 to 18 age group. So in case of psychiatry priority, depression or suicide is a prevalent cause of death in the age group 13 to 18. Now we are going to another age group. It is like 19 to 40. It is most adult, right? 19 to 40 or 41. So in this group, like you are, self-esteem or acceptance or establish the social relationship is most important. And also in this age group, they have two responsibilities. One, they are going to take care of their children, and also they have to take care of about their parents. So they're in between, right? So in this group is the 19 to 40. After 40 or 40 to 60, the next 20 years, main concern is to identifying any kind of disease or risk factor, because after 14 or 14 to 16, peoples are already start to fighting with again the disease. And also we have to consult in this age group to find out any kind of chronic disease or risk factor of the disease. Like if I'm 40 years old, if my family history is hypertension, I have a chance to also diagnose by the hypertension, right? The best way to anticipate the disease is to look at the like hypertension or hyperatherosclerosis or diabetes. In this age group, we have to find out any kind of risk factor, especially age group 40 to 60. And like my last, I believe I can explain with you. If I not, I will explain next class. In this age group, we have to keep in mind different kind of prevention, like primary prevention, secondary prevention, and tertiary prevention. Primary prevention means a little bit review, like immunization. Like you give the immunization your children to protect some disease, like polio vaccine to prevent the poliomyelitis, right? Or any other infection. Like sanitation is a primary prevention. Clean environment is a primary prevention. Then we have to go for the secondary prevention, like scanning or testing some of the disease, right? Like if a patient is diagnosed by have family history of the hypertension or diabetics, then they go for the check the blood sugar level. This is the scanning and secondary prevention. So recognize the disease. And last one is the tertiary prevention. So tertiary prevention example I'm giving, like any patient is already diagnosed the disease, then take the rehab medication or in the rehab center to stop the progress of the disease, right? So this is the tertiary type of medication. Now we are coming this main chapter, the age group 60 up, 60 up. So in this age group, 60 or 60 age up.
Excuse me, Dr. B. We're not seeing any slide.
Because I'm going to start this chapter. I'm just introduction talking with you.
Okay, all right.
Just I'm coming this age group, older age group. So this is the basic introduction. Now I'm starting this chapter. Care of the older client. So age group 60 plus for this PowerPoint. Okay. So just before to start, I'm saying if the patient is 60 plus, our main target to maintain their physical abilities. Maintain their physical abilities, I say, because in this age group, the patient do not maintain their body alignment, right? So in older person, when we take care of them, our main target maintain their physical abilities and also prevent the cognitive decline. Cognitive means their memory impairment, mental problem, right? Like develop dementia, degenerative disease, Alzheimer, right? And also the positive motivation if they are close relatives like spouse loss, grieve the loss, right? That times we have to give them the positive motivation, also very important. And when we take care of the older person, we always think about the medication safety, falling safety, and skin breakdown. Let's continue this PowerPoint. Here they said, I'm talking about this PowerPoint only the age group more than 60 up. So aging is the psychological process of changing that occur in a person between birth and death. So definitely our body system is all the time changing, right? Day by day, our like GIT going to lose their activities. So because of the aging, basically we lose the function of the bodies. So here, aging is a biopsychological process to change that occur in a person between the birth and death. And gerontology or tology is the study of the aging process, because still it is very challenging to the scientist. We do not stop the aging process. Sooner or later, everybody have to die. So science did not win this system. But the research, they are working how to stop the aging process. But the death rate because of aging is going, reducing. Also the life expanded, right? But whatever it is, because of the aging, our body system takes some change. Like cardiovascular system is activity is go down. GIT activities go down. So it is very natural aging system change. Like elder person frequently go for the urination or menstruation. This is aging process change, right? So whatever it is, aging process change. So now go here, what are the system by system change take place because of the aging? Okay, so first of all, they said the intragumentary system. What are the take change in intragumentary system? So in case of elderly person, as I told you, we has to take care of the patient, their skin, because the skin breakdown is most common in elderly person. So loss of the pigmentation in the hair and skin, loss of pigmentation on the hair, wrinkle developed. The young person, the skin epidermis layer is thick, but by the aging process, it will be thinner. So if the skin or epidermis is thin, it would be easily bruising, tearing, breakdown. If it is breakdown, ulcer developed. Also decrease the skin trigger, elasticity, and subcutaneous fat reduce. So subcutaneous fat just below the epidermis and dermis. So because of aging, subcutaneous tissue also less. Elasticity of the skin reduce, so easily break down. Increase the nail thickness, decrease the hair growth, and also decrease the perspiration rate, dry, itching, and scaly skin. So the skin is secretes some kind of secretion, sebaceous gland secretion, oily gland secreted, but because of aging, all of the glandular secretion is reduced, so easily skin gets dry, and dry skin itching is too much, scaly skin it is called, and also seborrheic dermatitis and keratosis formation because of this dry skin, right? So this is important for our daily life. I said when we have to see the older person in our family, just take care of them. Tell them to use some lotion to prevent the dryness of the skin, right? And also when we take care of the patient, we make sure if patient is immobilized, they change the, we has to help to change the posture frequently. So intragumental system, because of aging, the skin is get wrinkled, thin, dry skin, poor wound healing capacity will be poor, and also decrease the circulation to the tissue, which can cause ischemia. This is the intragumental system. What about the neurological? So neurological, basically the brain tissue get small. The brain tissue gets smaller. So neurological change, and also there are different kind of reflex present in the body. The reflex system is getting slow. Also slight tremor developed and difficulty with the fine motor function. Motor function means the function related to the muscle, motor function. Loss of balance because of aging, and also increase the incidence of awakeness after sleep, increase the susceptibility of hypothermia or hyperthermia. So because of aging, the thermoregulator system is imbalanced. Sometimes they hypothermic or sometimes feverish, right? Increase the temperature. Short-term memory loss or long-term memory usually impaired. So if the people has the dementia, sometimes they forget what they ate in breakfast. Short-term memory. If you ask what date today, what are the day today, they forget. But the long-term memory, they can remember, right? So in this picture showing the brain tissue getting smaller in the aging process. Here the cortical area is shrinkage, but in the normal, in the first picture, the neuron is healthy, but here the neuron is little bit shrinkage as well. Also some amyloid body or amyloid plaque is impact or developed, right? So normal neuron, and this is the aging process neuron. So here I said the nervous system or neurologically, the patient, the reaction also getting slow or reflex getting slower, the time or short-term memories decline, but long-term memory should be remain intact. Also their behavioral system take change, their behavior also take change. What next? Musculoskeletal system. Musculoskeletal, right? Muscle and bones. So muscle mass and strength decline, muscle mass and strength decline, and also muscle go for atrophy, means shorter. If you do not use your muscle will go atrophy. So because of our profession, we do not do exercise. Whatever your profession, at least 5 minutes or 3 minutes you has to do that exercise at least. So decrease the mobility, range of motion, flexibility of the muscle or joint reduce, coordination and stability reduce. Also change the gait, means movement of the joint, walking style change, slower, shortening the steps and wide base, also posture and stature change that cause the decrease the height. So also some of the client after 60 days or 60 up, the total height is going a little bit short. Also increase the brittleness of the bones. So bones is easily break down because lack of calcium or phosphorus absorption and also unequal distribution of the calcium or phosphorus. Also deterioration of the joint capsule or kyphosis develops. So curvature, abnormal curvature of the spine. Older client is the risks of fall because of change that occur in the neurological and musculoskeletal system. So during the aging process, we said the musculoskeletal system take place, decrease the strength or decrease the flexibilities. Joint, they have a usually complaint when they come in the health care provider office or hospital, they complain unusual pain. And also is a common complication. I mean, pain is a most common complication. Atrophy of the muscle, right? And also decrease the range of motion of the joint. So this is the most common. What next? Cardiovascular system. What are the changes take place in cardiovascular system because of the aging? So you know in our nursing science, this is one of the department, right? Aging process they deal with them, and also after the RN, if you want to do your family nurse practitioner or NP program, you can do it on aging system or this dealing with the older person and their care. So cardiovascular, so diminish the energy, right? And also lower the tolerance of exercise because of ability reduce, decrease the compliance of the heart muscle, heart valves, and become the thicker and more rigid. Also decrease the cardiac output, decrease the efficiency of blood return to heart, decrease the compensatory response. So less able to respond to increase the demand of cardiac system. So at the beginning, we told the intolerant, I mean, lower the tolerance of exercise. Why? Because when you do the exercise, your muscle demand of oxygen increase and your heart can supply. But when you are aging, when you do the exercise, your muscle need oxygen or blood supply, but your heart does not supply it. So increase the demand and decrease the supply, imbalance, right? So because of output is reduced, cardiac output reduced, decrease the efficiency of blood return to the heart, and also decrease the compensatory response, decrease the resting heart rate, also weak peripheral pulse, increase blood pressure, but susceptible to postural hypotension. So blood pressure increase, but when patient change their position from lie down to sitting or from sitting to stand up, their blood pressure is dropped, and this is called postural hypotension developed. So this type of change very common in cardiovascular system. So if you make summary, we say in case of cardiovascular fatigue with activities, so they can easily get fatigue with activities, and also the risk for blood clot. So is because of the aging, blood easily clot formation. So deep vein thrombosis develop, right? This is the reason we prescribe the blood thinner like warfarin. We prescribe aspirin to protect the heart. We prescribe the anti-cholesterol medication, statin, levostatin, right? So blood pressure suddenly drop, or also we have to check for orthostatic hypotension, very important for cardiac. Then go next system is called respiratory. What change take place in the respiratory system? In the respiratory system, decrease the stretch and compliance of the chest wall. So like if you take a deep breath, your chest will go up or down, expand is more, but because of aging, it should be reduced. Decrease the strength and function of respiratory muscle, right? Main respiratory muscle is the diaphragm, and accessory respiratory muscle is the sternocleidomastoid, intercostal. All is reduce the strength, decrease the size and number of alveoli in the lungs. Respiratory rate usually unchanged, and decrease the depth of respiration and oxygen intake. Also decrease the ability of cough and expectorant sputum. So here I said basically here decrease the ability of cough or expectorant respiratory system. So what if we make a summary, if we make a summary, what take place in respiratory system? Fatigue, I mean the patient easily get fatigue, and fatigue with activity decrease the oxygenation to the tissue, and also decrease the lung expansion. So lung expansion decrease oxygen to the tissue, and also fatigue with activities. Easily they get tired. And next go the hematological change, right? Hematological change means blood and blood product, basically this one. So hemoglobin and hematocrit level average towards the low or to normal, and prone to increase the blood clot, and also decrease the protein available for protein binding medication. So in our body, in our blood contain the protein, and when we eat the medication bind with protein, and then they transmit inside the blood. So it is called drug protein binding, right? But the protein is reduced, yeah, and also chance of develop blood clot. What about the immune system? immune system. So immune system tendency for lymphocyte count to be low. So the bone marrow can produce the immune cell like T cell, B cell, or other immune cell like natural killer cell. So all of cell, CD4 cell, CD8 cell, so all lymphocyte, T cell or B cell is going down, decrease the resistance of infection. So if the immunoglobulin cell is going down, definitely infection easily catch up them. So extremely older patient or extremely young like infant, both immune system is not well developed or established, impairment. So both of them easily catch up the infection. So you have to protect them, right? Immune system is impaired. Gastrointestinal system, what are the changes take place in case of gastro? Decrease the need for calorie because of lower the basal metabolic rate. So because of aging process, the patient basal metabolic rate is reduced. Okay, basal metabolic rate is reduced here, and also BMR, it is called BMR or metabolism rate. So metabolism is a chemical reaction where the food particles ending part of food particles undergo some chemical reaction and produce energy as a ATP and byproduct, also waste materials, nitrogenous substance. So metabolism is a process where the food is produce energy, but because of aging, the metabolism rate is reduced. Metabolism rate is reduced, right? So decrease the appetite, thirsty, or oral intake. Decrease lean body mass reduce, appetite reduce. Appetite means desire or eat, reduce. Reduce the stomach emptying time. So if they eat, then empty will be, usually it is 4 hours, but it would be longer. Also, they complain fullness, right? Increase the tendency of low constipation develop because the GIT movement is reduced. GIT movement, because of GIT movement reduced, their constipation develops. So what you have to do every day, make time and just go for a walk. When you go for the walk, your GIT mobility increase and you can prevent the constipation. Take plenty of water drinking, take fiber and protect it. Increase the susceptibility to dehydration. So always be hydrated, right? Difficulties with the chewing or swallow also difficult for them. So if we make summary, what are the change take place in gastrointestinal system in case of aging? It is more common dry mouth or decrease the appetite, decrease the chewing capability, and also become less, chewing become less effective. Also, circle of constipation develop, or sometimes fecal infection developed, right? Or alteration of the bowel. What does it mean? Like today is constipation, tomorrow diarrhea. Day after tomorrow, again constipation. After again diarrhea. So it is called alteration of the bowel habit. Most common, right? So now go here, another physiological change, endocrine system and renal system. This is very important. Endocrine and renal system, right? So here I said endocrine decrease the secretion of the hormones. So you know the endocrine actually discuss about some gland in the body, and the gland secrete the different kind of hormone or enzyme. Like pancreas secrete the insulin, glucagon. They secrete the amylates, because pancreas is a exocrine and endocrine both gland. So whatever it is, we're saying because of aging, the glandular secretion is dropped or reduced. Hormonal function reduce. So food does not digest well. Patient appetite reduce. Empty time of the stomach reduce. Metabolism rate reduce. Also decrease the glucose intolerance, right? Resistant to the insulin to the peripheral tissue, and diabetes developed. What about the kidney or renal system? Definitely the function of the kidney also reduce. So decrease the kidney size, function and ability to concentrate urine, and decrease the glomerular filtration rate reduce, decrease the capability of bladder, also decrease the residual urine. So patient most of the time complain, I have a urge of urine, increase the frequency. So they has to go for urination several times. Increase the urgency. When they desire of urine, immediately they has to go for the pee. Or nocturia, nighttime more than 3 times they has to get up from the sleep. It is very normal in case of aging process. And what are the reproductive system? Reproductive system decrease the testosterone production in case of men, and also the size of the testes is reduced, and change to the prostatic gland, and change in prostate glands, and also delaying the urinary problems, and leading to urinary problem, decrease the secretion of hormone is with the cessation of period or menstruation or means menopause. Definitely menopause start after 50 or 55. We are talking about the aging 60 plus. Already they have menopause. Their hormone is reduced or no absent, some of the hormone. Also the vaginal change increase the decrease the muscle tone or lubrication reduce. Also develop the impotency or sexual dysfunction in the both gender, right? Both cases they develop the impotency. And now I said if we make summary of the reproductive system, so in case of men, they impotency or erectile dysfunction, risks of benign enlargement of prostate, increase the prostate size. In case of female, they have a reduced the secretion, they have reduced the hormone. So if they go for intersexual intercourse, it should be painful, right? So painful intercourse or menopause developed. And here now another is called the spatial sense. I mean physiological change in the spatial sense. Like special sense means vision, hearing, taste, and smell, right? So vision means, if we talk about the vision means eye, the vision or power of eye is reduced or diminished. So visual acuity reduce or decrease the accommodation of the eye. What does it mean, accommodation of the eye? So suddenly, if we are young, we can see something long distance, also we can see something very close. This is called accommodation power of the eye. Because of aging, the accommodation power of eye is reduced, and also decrease the peripheral vision. So peripheral vision means we have a two type of vision. One is the central vision, other is the peripheral. Like you are watching towards the monitor right now, but if somebody is passing by, you can feel somebody is going passing beside of you. So central vision are looking towards the front, and peripheral vision, I mean towards the your ear side, they can feel, right, the peripherally. So both are reduced, and also presbyopia developed or cataract developed. So this is the cataract, right? Because of the aging process, cataract developed. Okay. So now also possible loss of hearing ability. So decrease with the high pitch sound. So hearing capability reduce, and also inability to discern the taste of food. So inability to develop the taste of food. So decrease the, especially between the sweet and sour, difficult to distinguish sweet and sour. The taste is reduced. Decrease the sense of smell. So decrease the ability of smell, right? And also change in the touch sensation. Sometimes it is difficult to distinguish between fine touch and other soft touch, or decrease the pain awareness. So this is the picture showing the cataract. This is the milky appearance on the eye, right? So if patient want, you can remove the or replace the lens. So now go for psychological change. Psychological change in case of the elderly patient, right? Psychological change means what we have to do, especially here. So psychological change take place. So adjustment problem, adjustment to deterioration in the physical and mental health or with well-being. Also threat to independence function or fear of belonging to burden or to beloved one. So adjustment problem, also adjustment to retirement or loss of because loss of income. So because when anybody all of the life they income, your life status is so high, but suddenly they retired, income reduced, it would be difficult for them to coping. So it is very important to motivate them, explain them this is the part of the life, right? So coping skill is most important. And also in this age group, the spouse, if they lost their partner, is also difficult to coping, right? Also loss of skill and competence developed early in the life, coping with the change in role of function and social life. And sometimes some of the patient can withdraw themselves from the social activities, but we have to encourage, diminish the quantity and quality of relationship or coping with loss, depends on the governmental or social systems, and also access to the social support systems, or cost of healthcare and medication is main priority for their age group, in this age group. What about the other I mean uh, priority for this age group? So I said, when the people is going older, is less than 60, more than 60 or 60 plus, in this, people has to depends upon so many medication. Their main priority or focus on the medicine, and also Alzheimer type of problem, dementia is most common, their support is less. So that age group, most important, medication safety, right? And also we have to know that because of aging, metabolism go down, and also high BMI, their fat is more, right? Because of this type of change, the medicine does not digest well, or medication does not expel out through the kidney, because kidney function also going down. All of this, because of all of this, main priority, medication safety. And also, as I told you, in that age group, or because of aging, the patient chance of fall. So prevention of fall, another priority, right? So I said another most priority is the prevent the skin breakdown. And skin breakdown occur because of poor nutritional status, or immobility, or restrain. All of this is very important. And what are the mental, right? Depression is most common. Depression, most common to them. So increase the dependency that older adult may experience can lead to hopelessness, helplessness, and also lower the sense of self-esteem. So painful, right? It is painful for them. And all of this lead to the depression. Another one is the isolation, because the children is going bigger, or is adult, and they are busy about their life. Also, some of the friend lost, or communication not easy, so they are isolated. So isolation, another problem. Isolation, the client is alone and also desire contact with others, but it is unable to make that contact. And suicide tendency, because of depression, if depression not treated, they lead to the suicidal ideation, right? Depression is different from delirium or dementia. So dementia is one kind of forgetfulness, right? So keep in mind, there are several types of dementia, but the dementia, I said, because of the degenerative change, one, or dementia can develop because of other underlying disease like Alzheimer, Parkinson, right? Dementia, easily forgetfulness. Another problem is called delirium. What it is? Delirium is also known as acute confusional state, right? Because they are impairment of their memory, so they can easily get confused, right? So delirium is an, decline from their abilities of the brain easily, okay? And it is sometimes caused some symptom. So depression differ from delirium and dementia. Definitely these three keywords is not same. And any suicidal threat from any old client should be taken seriously. So if anybody has an attempt of suicide, we need to give them special care, because if anybody take an attempt, the chance second or third attempt anytime they can do. It is important to give a special focus on them. Now go for pain management, right? The pain management is most important in this age group. So pain can come about from numerous causes and most often occur from degenerative changes in musculoskeletal systems, especially. The nurse needs to monitor the old client closely for the sign of pain. Failure to alleviate the pain in the older client and can lead to the functional limitation that affect the client ability to function independently. So keep in mind the pain sensation is reduced in old person, and also because of their body mechanics or system ability go down, sometimes their pain increase or their tolerance power reduce. Also they can easily distracted. And also, because of profession, if anybody has a pain or complain, we have to give them comfortable. So pain management. So basically, when we go for the pain management, we will try to non-pharmacological pain management first. Non-pharmacological, I said. If non-pharmacological pain management is not possible, then we have to go for pharmacological pain management, means give them some medication. So as I told you, non-pharmacological measurement means you have to give them some distraction, diversion their focus, or we give them some hot or cold therapy or massage therapy, massage, right? But keep in mind, we never ever give the massage if patient has any chance of deep vein thrombosis, or we will not give the massage over the bony prominent area. Also, never massage on the leg if the sign of deep vein thrombosis is there. And NCLEX asks this type of question, right? So we are talking about the non-pharmacological way of pain management. I said diverse their focus or distraction, hot or cold therapy, massage therapy. Then somebody like to meditation to God. You can tell them to do this. Music therapy or positioning, right? So if I ask about non-pharmacological pain management, which is the best method or which is the best method to work for the children? Distraction means change their diversity, their concentration, focus change. Which method works best for the teenage group? copying statement. Copying. And which method is, work best for adult, right? So in case of the adult, just tell them which one you prefer out of all. Distraction, hot or cold, massage, music, or position change. So all of this is very important about the pain management. Now come from some data collection like restlessness, then reporting of the pain, agitation, also crying. So this is some data to identify the severity of pain. Is it mild, moderate, or severe? And here now intervention about the pain management. What are the intervention we should do? Monitor the client for the sign of pain, identify the pattern of pain, what are the nature of pain, like is it burning pain, is it stabbing pain, is it throbbing pain, it is aching pain. So nature of pain. Also the movement or migration of pain. Tell them what are the precipitating factor you like to do and pain reduce or pain increase. What you do and pain increase. What you like to do and pain reduce. Monitor the impact of pain on the client activity to daily living. And also provide the pain relief through the measures such as the distraction, relax, massage, or biofeedback. Admin the pain medication, right? And also evaluate the effect of pain reducing measure. So we have to evaluate finally. And now here another problem most common, the infection. Infection also most common in case of elderly patient because they are immunocompromised. And also we discuss like skin breakdown is most common. If skin breakdown means skin easily get exposed to the pathogen and get infected. So confusion is a common sign of infection in elder person, especially infection of the urinary tract. I know it make you confusion too. Let me explain. The urinary tract infection is most common in the female and older person. The urinary tract infection, if untreated, they spread to retrograde direction, means from external urethra, then go bladder, from bladder to urethra, from urethra to kidney. Finally, if the infection or UTI is content for a long time and kidney function is impaired and increase some creatinine, and creatinine entered to the brain or nitrogen substance enter to the brain and causes the confusion. Carefully monitor the old adult with infection because of diminished or altered the immune response. As we know that the elder person, the immune cell, B cell, T cell is less. If the B cell, T cell, or white blood cell, neutrophil is less, then pathogen easily get attacked. Attack them. Non-specific symptom may include as well. And now some medication, right? So some medication here, last 3 pages here, medication here. So here I said the medication basically when we give them medication, it is important we have to make sure, and we know that the kidney function is reduced. If the kidney function is reduced or liver function is reduced, they does not tolerate the as usual doses. So we must reduce the medication dose. So major problem with the prescription medication include adverse effect or medication interaction, medication error, non-compliance, and polypharmacy and cost. You know, there are so many medication because of age, so many problem they have. So every day they has to take more than 2 or 5 tablet. There it is expensive. They have also so many medication interact with each other if they do not take in interval. And as we know, the metabolism rate reduced, so medicine does not metabolized well. Kidney function is reduced, so the waste product of medication does not expel out. So it is very important to give them the correct doses, right? Because the lower metabolism, higher BMI, or high fat ratio, higher percentage of body fat, and less percentage of muscle mass. So it is important when we count the doses. Polypharmacy, we should so routinely monitor the number of prescription. Also keep the use of medication to minimum. It is better. And medication doses normally are prescribed at one third to one half of normal adult dose. This is the important for our NCLEX board exam. Okay, so it is super important. Medication doses normally are prescribed at one third to one half of the normal adult doses. And another one, closely monitoring the client for side effect or adverse effect and response to the therapy because of increase the risks of medication toxicity. Why toxicity? Because kidney does not expel out properly. And also check the medication interaction in the client who is taking multi-medication. Advise the client to use one pharmacy and notify the consulting pharmacy healthcare provider, counseling provider for medication taken. A common sign of adverse reaction to the medication in old client is an acute change in the mental status. So this is also we has to know for NCLEX board. So it is the common sign of mental change. Now we has to go for the next. Yeah, safety measure, right? We already told the safety measure is most important regarding the elder person. The administration, the suppository, avoid the insertion of suppository immediately after remove it from refrigerator. It is better if we give them the room temperature. So when administering the parental medication, parental means medication any route except oral, like intramuscular, intradermal, right? So monitor the site because it may causes the medication or bleed. As a result, decrease the tissue elasticity. Also monitor the client and compliance with the taking the prescribed medication. So